My name is Walter Bochting and I'm a psychology professor and I co-direct the LGBT Health Initiative at Columbia University Medical Center. And this initiative is within the Division of Gender, Sexuality and Health and a collaboration between Psychiatry and the Columbia School of Nursing. The LGBT Health Initiative covers clinical service, research, education and training, and public policy initiatives to promote the health of LGBT people. The initiative has done a needs assessment across Columbia University Medical Center to assess how we can improve cultural competence and clinical competence across the campus. And particularly when it comes to children and adolescents, we have learned that this comes up very frequently and that our providers feel ill-prepared to address the needs of LGBT people. So what we have done is begun to develop a program of training to improve that. In addition to that, we have developed a research agenda and currently 2 research projects are underway. The LGBT Health Initiative has defined a number of priorities in the area of research, and they include research in the area of aging, as we now have a cohort, the first aging cohort of openly LGBT people, and to look at the challenges that they may face as they get older and as they interact with the long-term care facilities, particularly because families might be less available to them to be caregivers. And so we're interested in looking how do LGBT people in later life adjust to the challenges as they get older. Another priority area is families and youth. That we know that families are still ill-equipped to deal with a young person coming out as LGBT. Because what we find is when that happens, even the most supportive parents will need time to adjust, which may take really up to a year, whereas the young person, when he or she comes out to their family, could use some support right then and there. So we're looking at understanding that and then developing tools that can assist families in being supportive for their LGBT children. With regard to clinical care, we want to enhance cultural competence across Columbia University Medical Center, but we also recognize that LGBT people, for example transgender people, have some specific health concerns that may require a separate clinic or an afternoon or evening in an existing clinic. For example, a transgender medicine clinic where they can have access to hormone therapy, which is a specific health issue that just pertains to that group. So it will be a combination between special clinics for special subgroups of the LGBT population, as well as just in general that all of our facilities will be more accessible and more sensitive and trained to serve LGBT people. The LGBT Health Initiative also has a mission in public policy, and what we're thinking there is to really do the research needed to affect public policy and public policy decisions. So oftentimes when issues come up, the evidence might not be there, or the evidence might not be organized in a way that policymakers can take full advantage of it. So our plan is to conduct research to add to the evidence base and organize it in such a way that policymakers can actually make decisions based on scientific evidence. This is a unique time in, I think, the history of LGBT people and in LGBT health, with people coming out at younger and younger ages, and finally there being more support to really understand the challenges that this population faces and how that affects their health. And so what we're doing here is building a critical mass of activity at Columbia University to answer some of the questions that are pertinent right now through research, and to translate that into training and practice. And then eventually we hope to build a center that will last and continue to be a resource for LGBT health to improve the lives of LGBT people.